Okay, the 13 safety practices. 1, verify care and order for your client. 2, hand hygiene before and after care and when handling equipment. 3, verify facilities policies and procedures when it comes to handling equipment. 4, consult manufacturer when using equipment. 5, hand hygiene. 5, knock on the door. 6, use 2 identifiers when identifying your client. 7, note overall condition of your client. 8, explain the procedure and provide privacy. 9, raise the bed for good body mechanics. 10, don PPE if indicated. 11, lower the bed all the way down per facilities policy and place the side rails per their care plan. And then if you note anything abnormal, let the charge nurse know. And then the 7, rights of administering medication, right dose, right drug, right documentation, right time, right route, right indication, and right patient. Okay, so for my patient today, the bed will be already raised, so I don't have to mess with it, and the rails are how they're supposed to be. So I would enter her room. Hi, my name is Jody. Today I'll be your nurse. I will be giving you your IV today. Can I please have your name and date of birth? They've given me their name and date of birth. This is the correct patient. Next, I will ask if they have any allergies. They are allergic to rum. So now I will begin my IV insertion. I will have hand hygiene already, and I will now, first I'm trying to find which vein I'm going to use. So I got the physician's orders, and the first thing we have to do is draw blood and insert the saline lock. So while I'm here now, I'm putting in the catheter and I'm gonna draw my blood. Nothing's expired or tampered with, everything's good. For now, I'm just gonna take out my tourniquet. This is when I'm just trying to find the vein. I'm gonna put it below the joint. I'm gonna be using the vein in the lower forearm. Found the vein. I'm gonna be using this vein here. Now I'm gonna relieve pressure. So, because it can hurt, we don't want shearing of the skin. Now I'm going to clean it, push it in, circular motion from the inside out for 30 seconds. Once I'm done, I'm going to let this dry for 30 seconds to a minute. While it's drying, I'm going to prep everything else. My tubing has already been primed, so I'm just going to attach the normal saline to it. I'm going to take out my tape now. Next, I'm going to open my needle and catheter. Okay, so I am putting the tourniquet back on, not touching the site I just cleaned to contaminate it. Okay, the vein's there. bevel side is up, holding the skin taut. I'm going to insert the vein 15 to 20 degrees. Once I see a flash, I am inserting the catheter while simultaneously pulling out the needle. Now I can occlude it, release the tourniquet. This is when I'm going to get my blood. While I'm here, I'm just going to tape this down so I can have better stability. Occluding it, disconnecting it. Throw that into the sharps container. I'm going to attach my syringe. I'm drawing up blood slowly. I'm making sure that it's in right. I'm getting blood easily. I'm pulling up slowly. I'm getting it for a CBC and a Chem 7, so I need at least 10 milliliters. Now that it's full, I'm occluding it again. I'm making sure I can disconnect it. Now I'm attaching my extension with the saline lock on it. I'm going to add another piece of tape. Okay, this is when I will release, pull back, see, make sure I got in a vein, and there'll be blood return. Then I'll push it all the way in, flush. Then I will disconnect here and do this. Making sure there's no redness, inflammation, infiltration, phlebitis, anything there. I'm gonna attach my tubing. I'm gonna initial it, date, and time, and gauge of when I did it. I'm gonna make sure he's not feeling any pain. I'm gonna clean up all my stuff. Okay, and now it's been a little bit of time. I came back in, there's new orders, there's new gloves, new hand hygiene, and I need normal saline at 125 milliliters an hour. I already primed my line, I hung my bag. I'm gonna make sure I take a alcohol pad and clean off the top before inserting my line. Okay, I set it at the right rate, and the right rate is 125 milliliters an hour of normal saline. Making sure he's okay, everything's fine. I've lowered the bed, he's back in his comfortable position. Now I've come back a little while later, hand hygiene, new gloves. Now I'm doing my last orders, which was morphine, 2 milligrams IV stat. So I verified the medication. This is my morphine. I'm gonna put it in the port closest to his arm here. Kinking the line. Before I insert it, I'm gonna make sure that it's clean. Wipe it off with an alcohol pad. Let it dry. Attach the medication. Morphine, it takes a little while so you're putting it in slowly. Our order is for 2 milligrams. So I'd put in a milligram. I put in a milligram, then let it go, and then do another milligram. So do it over the 2 minutes, so it has to be slow. I don't have to dilute it because I already have normal saline hung. When it's done, I discontinued it. Made sure his call light and reach. Before I gave him his morphine, I would have asked him what his pain level was, and then I would have come back 30 minutes later to reassess his pain level, made sure he was okay, his respiration rates were normal, and any abnormal findings I would have told the charge nurse or the doctor. And that is my skill.